Hi, my name is Oscar. I'm an SPTA here at Institute of Technology, and today we're going to be going over ultrasound and how to properly use it. Thank you, Andrea, for coming in closer. So first things first, we're going to plug it in to allow it to turn on. Right? It takes a minute for it to turn on, but might as well just turn it around just to show you guys. This is how you turn it on. There's a switch, and this is the contrast, so you can see the display screen. And then the transducer liquid right here. I'll leave this right here for now. So flip the switch. Let's turn it on.
Right there.
Cool. Any second now. All right, cool. So now we have, so that's the contrast. That's what we were talking about earlier, right? To your liking, okay? You can pick this up. You can take the cap off. It's easy, put that down for now. We'll click the ultrasound settings. Obviously this has electrotherapy, ultrasound, and a combination as well. We wanna go into the ultrasound setting. Once it does that, the screen pops up. Right, the application size is transducer head here, right? So this one's 5 centimeters squared. The frequency is in megahertz. Right now it's set for 1, which would be D. The duty cycle is set at 100%, which is continuous, and it's also thermal. And then the display, which is the intensity, is watts per centimeter squared. And treatment time right now is also set up for 7 minutes, right? We're gonna have to adjust that to 8 minutes, just so we can kind of build for that too. So we're gonna go into edit mode. Cool. So this one also has the head warming option, which is nice for those patients who are sensitive to kind of like the cold, right? So we'll warm it up. You can push it on and off. Right, so that's on. We'll start warming it up. We're gonna leave it off for now. Frequency is 1 megahertz. 1 megahertz. If we go to 3.3, that would be superficial. So if we go back to 1, that's going to be deep. Now we go into duty cycle, right? It's set at 100%, which is, like I said earlier, it's thermal and it's continuous. Right? So we can also adjust that to 10, 20, and 50%. Right? Anything less from 100, according to Mr. Meyer, is not thermal. So we're going to leave it at thermal for now. There we go. And then the display should always be in watts per centimeter squared, right? So if it has that option, just make sure to go back into that. And then another thing, treatment time. So this one says 7 minutes. We're going to go into there, and we're going to go up to 8 minutes, so we can also bill for that. Awesome. Cool. So now, next thing, right, this little knob here is gonna also move this little number here, right? You can always start at 1, right there, right? And if a patient tells you that they feel like it's too hot or anything like that, you can take it back down to 0.5, just like that, okay? So we're gonna go back up to 1. So first things first, we're gonna do now. Let me get the little transducer look at, and it's gonna be about dime size. Just like so. Nice and easy. Cool. So now we have a medium on the transducer head, so that actually helps the crystal to stay contact and it doesn't break, right? So after we do that, we'll push start, and then push start just in case. But we can push start, and it'll start vibrating. Mr. Meyer showed us that. That's kind of how you check to make sure the crystal works, right? So as soon as you turn it on, the gel will start vibrating, right? So we'll push start, and then for treatment, right, nice and easy. You kind of go in small circles, right? And then you never want to lift it off the skin. Mr. Meyer did say you can kind of scoop it just to kind of get the little gel-like substance. Right. Nice and easy. And then what you don't want to do when you are doing this is leave it in one spot. If you leave it in one spot, thankfully it's not on, but if you leave it in one spot, it causes periosteum burns, and that is very painful. We do not want that. And it's nice and easy, just going in small circles. And you always want to make sure you have some kind of gel in there. Right? And again, this should be set for 8 minutes as well. So it'd be a long 8 minutes. And then you can always adjust the intensity, right? So again, right now it's at 1 watts per centimeter squared, but you can always bring it back down if you need to, or if the patient feels like it's too hot, okay? And again, continuously moving, right? Over and over again. So once you do, let's say the 8 minutes are up, right? You'll go ahead and take it off, right? Nice and easy. And then you can push stop, and then it'll stop, right? And then after that, you can just wipe the trim juice your head, right? Nice and clean. And once it's nice and clean, you're gonna go ahead and put the cap back on, which is over here. Okay, and place this back. And then you can also use the rag to wipe it down, just to make sure that the patient's all clean afterwards too. Just like so. And once you're done there, easily just go back on and then unplug it. Boom, just like that.